Hello, everyone. My name is Dr. Ngozi Onoha, and I'm the founder of Health for Naija podcast. I provide health education and awareness to global audience. Today is June 15th. It is World Elder Abuse Awareness Day. This day is designated to raise awareness on how to build a strong support for older people. Today, I have a special guest on the program. Her name is Dr. Osi-Ogbu. Dr. Osi-Ogbu is an American-trained and board-certified geriatrician and consultant who's based in Nigeria. She is a member and a fellow of the American Geriatric Society, and she's also a fellow of the West African College of Physicians. Welcome.
Thank you, Ngozi. It's good to be here.
So happy to have you and glad that you found the time to talk to us on this day. I think it's very important to raise awareness. So before we start, please tell me what is elder abuse and why should we be concerned?
Right. So it's really a very important topic. So elder abuse is simply any act, either a single episode or multiple episodes, that actually erodes the freedom of older adults to make their own decisions or to continue to be who they want to be when they want to be. It usually involves relationships with people that they trust, who then either omit to care for them or outrightly actually mete out physical abuse or sexual abuse or financial misappropriation of their of the money for these older adults. So that there is a relationship that involves trust, and that relationship is the trust in that relationship is broken, okay, and it causes harm or distress to an older adult. And really it's important because at that stage in life, after all the toiling and working in later life, we want to have the freedom and autonomy to do what we have desire for, and also to believe that those in relationships of trust with us would not breach that trust. Whether or not such an older adult has physical disability, cognitive disability, and I'm already going into those older adults that tend to be abused. They're often those that have some kind of impairment. Whether it be physical, so there is a very high level of dependence on others. And when they need care from these people that, be it caregivers that are paid or family members, when they need the care from such people and the care is not provided, leading to neglect, it is a form of abuse.
Okay. So basically, vulnerable people who are vulnerable, people who are ill. And as we know, as people get older, they tend to have more illnesses and more dependence on others for so many things, for mobility, for care needs, preparing food, taking care of personal hygiene.
Right.
So basically what you're saying is that if that person is in a position where they're depending on somebody else that they've trusted, that predisposes them to a setup for elder abuse, basically.
Absolutely.
Yeah.
Right, and it's important. I think the second part of your question was why should we be talking about this? So the world is aging. We know that we're going into a demographic change or transition globally. In 2015, those 60 and above, whom we refer to as older adults, were about 900 million. And we think we're going to have about 2 billion by 2050. So we're definitely going to have many more older adults. We hope they all remain healthy, but we know that increasing age is a major risk factor for disease and disability. So we're definitely going to have many more older adults who will be dependent, which would mean that we would have increasing prevalence of or incidence of elder abuse. And really, just to give you some numbers, there was a 2017 review across about 28 countries that came up with statistics saying up to 1 in 6 older adults actually reported having had some form of abuse in the previous 12 months. There was also data coming out of institutions where, long-term care facilities, where up to 64% of the healthcare workforce had admitted to actually abusing an older adult in the previous 12 months. So and we think it is grossly underreported.
Right.
One of the reasons for that is that some don't even recognize it. The way we approach our older adults, the tone of voice, your language, and we find, particularly in certain parts of the world, in Nigeria where I practice, the first question somebody would ask is, "Oh, abuse of older people. Nobody does that. Who does that?" But it's happening every day.
Right.
When you see that older adult whose skin is wrinkling, they're using a cane to walk, and might not be looking as pretty as they used to look, you might really want to just ignore them. And when they talk to you, you might not approach them appropriately. We see them in the queues at the banks. We don't give them the extra respect and prioritize them on the queues. All of this really contribute to the distress that they would feel in such a situation. You're increasing their vulnerability, and it's a form of abuse.
Yeah, I mean, I'm listening to what you're saying, and I think a lot of the support is, in a way, shall I say, the establishments or the communities. Let me give you an example now. For instance, right. I live in Philadelphia, so when I get on the bus, there are specially designated seating for older adults, older right. or disabled adults. Same when you travel across the world. If you go to, right. for instance, if you go to London, on the train, on the tube, on the buses, they have designated seating. And in my travels in Africa, I've not really come across those sorts of scenarios where they're designated seating for older people. So I think a lot has to do with the sort of environment that we find ourselves in, as to the awareness that, right. okay, this is an older person, and the person has a walking stick and they have difficulty moving around. So we should offer them a seat. Let's get up and offer them a seat. Sir, ma'am, would you like to sit down? So I think doing this, hopefully somebody somewhere is going to be listening to this conversation.
So let me give you the good news. So we now have, really some good things are happening in the country, at least in Nigeria. We have a national policy on aging, which would be a roadmap for us to, develop programs for aging and for older people in Nigeria. We also have the Act of the National Citizen Center, Act of 2017, that has already been made into law. And a Director General has already been appointed to run the National Senior Citizen Center. And it's actually about a year now since that DG has been in office. And I can tell you, it was the best of choices for this DG that was appointed, because she's been an activist in the aging space. And this was just to give her a platform, and she's been running. So aging is multi-sectorial. Just like you've said, we need to change how we think about aging. We need to make the environment age-friendly. And these are all of the things under the mandate of the NSCC. And I can definitely tell you that the DG is looking into all of this, already collaborating with the different ministries and departments and agencies of government. I mean, almost every MDA has aging in their mandate, but has never been looked at. So what NSCC is doing is saying, hey, your transport, there is something that you have to do for older people, just what you're saying now. Can you ensure that there are designated seats in every bus? We need to raise the awareness, liaise with NURTW, the National Union of Road Transport Workers, so that there's a lot of advocacy, not even just to the rest of us, but even the older adults, for them to challenge the system and assert their rights, because they have a right like everybody else. The Nigerian Constitution, says that, everyone, by virtue of the government, or being a Nigerian, regardless of your age, your gender, your geographical location, you have the rights. So we need to bring this up and invoke this in every ministry and department and agency, and ensure that our older adults get their rightful needs put into place, and they can actually live with improved livelihood, self-fulfillment, respect, and joy in our environment.
Yeah. So I'm so glad to see there's implementation of programs that will help foster the support, the community support that older people need. I think it's very important. So let's go to my next question. So I want to know the types of elder abuse. I know you mentioned it briefly. And then what can we do to actually stop elder abuse? We know today is World Elder Abuse Awareness Day, and it's really to kind of get us thinking about what we can do to prevent elder abuse getting worse and curbing it.
Right. So there are several types. We talk about physical abuse, where you actually find an older adult, either being hit by, a child. It could be an older woman being hit by the spouse. It could be a patient in a nursing home being hit by the caregiver. So that's physical abuse. And there is sexual abuse. There is psychological abuse, which comes from the way we talk down on older persons, particularly those who are frail, those who have disability. And in fact, it could also be an act of omission. I'll give you an instance. I have a 70-year-old who's been wheelchair bound for about 4 years now, because her daughter would not give her the 2 weeks that she requires to come and be with her in the hospital to have her knee replacement, from very severe and disabling osteoarthritis of her knees. So this woman is so fearful of this daughter. That's psychological abuse. There's financial abuse, where, and this we find more commonly in those who have cognitive impairment. So you have a woman who has lost her cognitive function, and maybe a caregiver or a child, has access to her funds, of her finances, and misappropriates the finances without recourse to this older adult. That's financial abuse. Or when, someone whose money is there in the bank, but because you are the one who has control over it, and she says, oh, I need money to do this A, B, C, D. And you say, no, that's not what you should be spending money on, even though it's her money or his money. So that's So those are the four main types that we really tend to see: physical, psychological, sexual, and financial.
And I think there are other very subtle types of abuse. I mean, people sort of see abuse as, oh, it has to be extreme, but there are also some very subtle forms of abuse. And I think one of them is neglect or abandonment.
Yes, absolutely.
Neglect or abandonment. And I think, especially when kids get older and they move away and they don't go visiting parents to know what is, or their older, relatives, to really understand what is really, really going on. So I think after a while, they lose that touch and they lose that connection. And I think it's a very complex issue. So how, if someone suspects that elder abuse is going on, what are the things they can do? How can they intervene?
Right. So, in fact, we're having a conversation earlier today where this researcher was talking about the fact that we've always focused on the individual who's abused, but we now have to start looking at those who actually perpetrate the abuse. What are their characteristics, so that the older adults can start looking for telltale signs to know that this individual might actually be, I might be at risk of being abused by this individual. And it's really a paradigm shift, because we've always sort of looked at, who is at risk, those with disability, and all of that. So in combating that, we actually have to look at what we describe as ageism. Because some of those who are abusing older adults, like you said, the subtle things, the neglect and abandonment, might just come from poor understanding of what aging is about, and those age-related conditions that put older adults at risk of the things that they go through, the multimorbidity with the disability and all of that, and the risk of dependence. So there has to be better understanding of aging and age-related conditions. So we talk about combating ageism, where age is not synonymous with disease, where age is not, where older adults are not seen as being spent, no more relevant, and in fact, you're better not here than here, and giving me all of this burden to deal with. So combating ageism is one major strategy for actually dealing with elder abuse. So changing the narrative around aging, and seeing, we need to combat ageism at multiple levels. Institutionally, we were just talking about how the environment needs to be friendly. Yeah. You go into a bank, you go into a vehicle, and all of that. And then at the community level, what are the programs that the community is putting into place to give older adults a platform? If we can ensure that older people live as healthy as possible at the community level, they will continue to give back. And in giving back, they enjoy self-fulfillment. The community also gets to harness the benefit of longevity. So there are multiple levels of intervention. The WHO has given us the decade of healthy aging, and really just for us to focus or shine more light on those determinants of healthy living or aging that we must overcome, so that at the community level, people are aging in place and aging well. So we have the ICOPE strategy, which is the integrated care of older persons, that focuses on being able to identify those common conditions that will tend to affect physical function, mental function, and quality of life at the community level. So vision, hearing, nutritional status, mobility, and cognition, and vitality. So all of those, the ICOP strategy looks at, and very simple guides that really can be replicated across communities all over the world. So again, that's one of the things NSCC is trying to do, that we roll out ICOP strategies at the community level by training the minimum set of staff we should have at the primary healthcare centers across Nigeria to know about aging conditions and be able to assess our older adults as they're aging for this condition that we know will affect their health status. So if we're able to do that, then we get more people to be healthy, even those who have some kind of disability, making sure that assistive devices are available for them to use.
We have Dr. Osi-Ogbu, consultant geriatrician, and she's speaking all the way from Nigeria, and her video just froze. So we're basically talking about what we can do to reduce elder abuse. And she talked about some of the programs that are available and resources. And if anybody suspects elder abuse, they need to contact their social services department, local health department, or the physician involved. In America, contact the Adult Protective Services. So that's all for now. I want to thank you so much for joining us. And if you gained information from this podcast or video, please share with your friends and put your comments in the comment section. So until next time, we'll catch up again with Dr. Osi-Ogbu. We had her calling from Nigeria, and the video, I guess it just froze. So we'll catch up with her another time. Thank you so much, everyone, and have a wonderful day. Bye for now.